Chris, we're down here at the Town & Country Hotel for the 32nd Annual Chargers Blood Drive. And the point, of course, is coming down and giving blood and helping save lives. But that's not the only thing going on. While you're here, you can check out all the live radio broadcasts that are going on. You can get autographs. You can also visit the wellness zone that they have set up in one of the other ballrooms just down the hall.
Yep.
And we're joined right now by Stefan Moldovan, who's a general and vascular surgeon with the San Diego Vascular Center, who's manning the one of the tables at the Wellness Zone today. Doctor, good to have you on.
Thank you very much.
So vascular surgery, like Dr. Richard Kimball from the movie The Fugitive. He was a vascular surgeon.
What are you coming up with here?
No, any one-armed men. It's the first thing I thought of. I saw it on Netflix a couple of days ago.
Pulling out of thin air. Well, look, this whole event, Doc, is about bringing the community together, and I think it's great now that the blood bank and the blood drive has kind of added this wellness center to the whole thing.
Sure.
Because so much of what medicine and the whole thing is learning and teaching people, and I think that's kind of part of this whole process.
It is, and preventive medicine is important, and this is what we advocate here. We basically have a vascular lab. In other words, we offer minimally invasive imaging modalities. It's actually non-invasive to look for or to screen for potential life-threatening situations. Patients who may have blockages in their carotid arteries, the blood vessels that supply the brain with blood, and they are at risk for stroke. Patients who may have an abdominal aortic aneurysm, in other words, a dilatation of the main artery in the body, or patients who have difficulty walking and have blockages in their arteries in the legs. This is, again, a very simple study to do that could catch a disease process in the early stages.
Doctor, we talked a little about it when Rolf was here, but performing surgery, I think people don't realize sometimes how many units of blood are necessary sometimes when you're performing. And when you have an event like this, just talk about how important it is just to be able to perform these surgeries that people donate blood.
Yes, it is extremely, extremely important. I'm very happy you brought that up because there are operations in vascular surgery, emergency operations, where somebody comes in, for example, with a ruptured blood vessel, a ruptured aortic aneurysm, and the patients who actually make it to the hospital sometimes require an enormous amount of blood transfusions. So it is wonderful to see so many people coming here and offering their blood.
Well, the thing that's really nice now, this whole blood drive, the San Diego Chargers annual 32nd annual blood drive, but not just about coming down and giving blood, which is a great part of it, but the blood drive kind of giving back to you people who come down here in the form of having doctors out here to help us learn, help us understand, help us be a little bit more knowledgeable. And so we kind of hope everybody will drop by the Wellness Center when they come down today and say hi, right?
Very good. It will be great. You can check us out at our booth, or you can check us online at SanDiegoVascularCenter.com.
Dr. Moldovan, thanks for stopping by. We'll check out the booth when we get a chance.
Thank you, Doc.